Welcome to Kindly Neurodivergent with Kay. Before we start, a quick note. This episode is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. And if you notice pauses in our conversation, that's intentional. That's part of how we talk. In lieu of Cerebral Palsy Awareness Month, I have Dr. Cerebral back with me. He will be discussing total hip replacement. Welcome back, Dr. Silver.
Thank you, Kyla, for inviting me again. It's a great privilege for me and an honor to be here with you and discussing matters related to cerebral palsy and orthopedics in an informal, friendly way that I hope it's helpful
Yeah.
to the patients out there.
Please introduce yourself for anyone who haven't watched any of other episodes.
So my name is Paulo Selber. I am an orthopedic surgeon. I'm a pediatric orthopedic surgeon by trade, but my first mentor more than 30 years ago said that if I was going to treat kids with PC or with cerebral palsy, then I would have to be able to treat the adults as well. Well, and he was the person who was ahead of his time thinking about adults with cerebral palsy
Yeah.
more than 3 decades ago when nobody was even talking about them. So here I am. I've been doing neuromuscular disorders. Initially, I started my career in Brazil. Then I spent most of my life in Australia, working in Melbourne and Sydney, concomitantly in Australia for 20 years, but in the two cities for 10 years together. And then I was invited to come over to the United States, and I've been working at HSS now for approximately nearly 5 years now. And
Whoa.
yes, and it was Columbia University that initially made the kind of invitation for me to move from Australia to this little town of New York.
What is a total hip arthroplasty, which is also known as the total hip replacement?
That's why I like Kyla. She goes straight into the business. We came together with this theme because total hip replacements have been around for a long time, and they are probably one of the most successful medical interventions that there is, and also in cerebral palsy. So total hip replacement is when very specialized orthopedic surgeons, I don't do those surgeries, but there's a lot of people here at HSS that are exceptional in doing that. And when they go and they take some parts of the hip joint and replace them with metal parts.
How can hip conditions affect a patient's functional ability?
Well, hips, like any other joints, once they are worn out, they can hurt. That's what people call arthritis. And when you have arthritis in the hips, it produces a lot of pain and stiffness. In cerebral palsy, hip arthritis is common because of many reasons. Because in many patients, the hip don't develop typically, given the limitations in mobility. And also, very often, the hips don't sit well in the socket because the muscles with spasticity and with dystonia act to push or pull them away from the socket. This is what we call hip dysplasia or neurological hip dysplasia. It's something that happens from childhood on. We need to be vigilant, us that we orthopedic surgeons that treat CP, we need to do what we call hip surveillance, take x-rays from time to time, and make sure that the hips stay in. But I've noticed I am one of the few people around that see the adults with CP, and I have seen them for more than 30 years. And I noticed that even hips that are in the joint in cerebral palsy can suffer arthritis as well, and sometimes very prematurely. Typically, aging people will have arthritis as well because we are outliving our hips, and eventually, all of us will probably require a hip replacement. In CP, that can happen at any time, at any age.
Is it more common with a specific movement disorder more than others?
That's a great question, Kyla, as usual. I I suspect that patients that have mixed tone cerebral palsy, and by mixed tone I mean spasticity and dystonia, are the patients that are more prone to have issues with their joints. But this is just anecdotal because this is my observation. Nobody has written a paper, proving my observation and my theories. I think when you have dystonia and spasticity, the forces that go across the joints caused by the muscles being overactive at all times, the forces themselves are enough to um, tear the hip joint and the cartilage and produce the arthritis and pain.
Is it more common with people who walk or not?
Pardon me, I didn't understand the second part of the question. Is it more common with people?
Is it more common with people who walk?
Um, no, I suspect that it's more common in people that are wheelchair users because they tend to have more spasticity and more dystonia. But I've seen in all groups of patients with cerebral palsy. Just coincidentally, yesterday I saw a lovely lady at the age of 50 that has an arthritic knee. And in her case, it's because the bones are a bit twisted, and she's walked for many decades on twisted bones, which causes more abnormal forces at the joints. And I recommended that she should see a specialist in total knee replacements here at HSS. I think it happens in all groups of cerebral palsy. For those who are familiar with the gross motor function classification system, the GMFCS, I think it can happen to GMFCS 2s, 3s, 4s, 5s, and at all ages.
How do you evaluate whether a total hip replacement is necessary?
Well, there are many things that we have to consider. If the patient is uh, feeling significant pain, chronic pain of the hip joint, and if the patient's mobility has decreased and there is more hip stiffness, and if the amount of spasticity and dystonia as a result of pain, which is usually the response of the brain with cerebral palsy to pain, is increased. So pain leads to more movement disorder, and in my opinion, rapid deterioration of function, much more rapid than in patients typically developing. And that's why I tell my colleagues here at HSS that when we have pain in cerebral palsy of orthopedic origin, we must act soon because patients deteriorate their function very quickly, unlike the patients that are developing typically.
Is it more common with adults or kids?
It's more common with adults, but kids that have severe or significant dystonia and spasticity, they develop hip dysplasia, subluxation when the hip is halfway out, or total dislocation. they can develop it very early in life, as early as 2 or 3 years of age. That's why X-rays of the pelvis in certain groups of patients with
Yeah.
CP are an essential evaluation in the hands of orthopedic surgeons, pediatricians, rehabilitation physicians, or physiatrists. We need to check the hips clinically through physical examination, but also radiographically, because hip dysplasia can happen in this group of patients at any age, including early ages. And initially, it's a silent, it's like high blood pressure. Nobody feels it.
Mm.
So you need to keep an eye open and check all the time to make sure that the hips are staying in.
Are patients required to attempt conservative treatments, such as physical therapy, bracing, or injections, prior to surgery?
Yes, I think the very good orthopedic surgeon who respects the ethical principles of medicine will always try to treat these hips conservatively first with injections, physical therapy, manipulations, etc., medications. Of course, sometimes that's why a lot of these patients come to me because they want my opinion because I'm considered a CP surgeon. So I've seen a lot
Yeah.
of patients with CP in many years of my life. And they say, do you think I should go for a total hip replacement? And I look at them and examine them and try to get to know them. And sometimes I'm actually the one surgeon that is trying to tell the orthopedic surgeon who will do the hip replacement, please don't wait too long, because this person, for instance, was able to walk independently just three months ago, and now she's or he is requiring crutches already or a walker. So in patients with cerebral palsy, I think conservative treatment is always indicated, but we need to act, more promptly if we see that it's not working, and fix the problem and fix the pain if we can.
Does conservative treatment successfully prevent any significance?
Uh, I believe that depending on the stage of arthritis, if it's severe, which is usually what we see, conservative treatment does not solve the problem. I think eventually, if the patient is a good candidate for total hip replacements, that's what's going to fix their problems.
What happens to movement disorders after hip replacement?
That's a very good question, Carla. They settle down in most cases. Of course, the baseline movement disorder that the patient had before the patient felt pain will still be there. But what happens is that as the patient has more pain, the movement disorder worsens. And once the pain is relieved by the total hip replacement, which is almost always the case, the movement disorder settles very dramatically. I'll give you an example of a patient that was just operated recently. She came here to see me in Westchester at HSS, and she was basically, she's relatively young patient in the 30s, and she was basically not able to walk much anymore because she was so stiff and in so much pain. And moving the involved lower limb was really hard for her. She had her total hip replacement about I would say probably 4 or 5 weeks ago. And sure enough, she's walking with her walker again. And you should just see the very beautiful smile on her face,
Hmm.
how she's, how pleased she is.
How do you determine the appropriate surgical dose and components, hardware, for a successful outcome?
Look, I will let you ask that question to the very specialized people that do these surgeries. But what I know is we know that the anterior approach in these patients is probably it's probably safer because it spares the muscles. And one problem with total hip replacements in anybody is when the hip replacement itself dislocates. And of course, when you have spasticity and dystonia, if those muscles pulling hard can dislocate even a total hip replacement. So when they do the surgery using what they call an interior approach, all the musculature that holds the hips together in general stay intact. So I think that's their preferred approach for these patients. Regarding the components, I know, but sorry for my ignorance. Remember, I'm not a total hip specialist. I know that they take very specialized CT scans of the patients and they measure the bones very accurately. And it's almost like they make uh, tailored components to that very specific patient, with the precise measurements and so on. So it's a very sophisticated way to do total hip replacements nowadays. And of course, HSS has the top technology in that. And they use robots to guide the implantation of the components and stuff like that.
What is the typical duration of the surgery?
Well, I saw one of my patients with one of our doctors here. I wasn't in the OR, but my assistant was there with the doctor, and the surgery took about 1 hour and 10 minutes. These other patient that I just mentioned, I think it took a bit longer. And what happens is that in many patients, I operate on the patients before the total hip replacement to give the hip more range of motion by operating on the muscles that are very tight. Because if the patients come in with very severe deformities, then they can't do the total hip replacement.
Mhm.
So what I do is I go there and I do my surgical tricks to try and relax the muscles around the hip, so that when they get onto the total hip replacement, the hip is more flexible. With one patient just recently, the specialist in total hip replacement did the total hip replacement, and I went in right after the total hip replacement was done, whilst the patient was still anesthetized, and I examined the groin muscles, the adductors of these patients, and they were really tight. And I went there and I did some surgeries to the adductors to relax them right after the total hip replacement on the same anesthetic day.
What are your recommended practical strategies for recovery?
Look, I prefer that the hip replacement doctor recommends because they have all their protocols. Of course, I know a couple of things about patients with CP. And one of the crucial things for recovery is the use of Valium postoperatively, because Valium, or if you prefer, diazepam. Diazepam is one of the most powerful muscle relaxants. And of course, when you have surgery and you're anxious and you're scared and all of the above, and there is the surgical pain, movement disorder increases even more right after the surgery. And it is we must be very active and aggressive in terms of controlling pain and the spasticity and dystonia.
Yeah.
Why we prescribe a lot, of course, in safe doses, Valium postoperatively and for many days after the surgery. That's one thing that a lot of orthopedic surgeons that do total hip replacements out there and don't understand CP, they don't know. I've seen patients who have had total hip replacements done in other facilities, and they progressed with severe contractures after the replacements because not only they were not treated with the muscle relaxants properly, but they didn't get enough physical therapy. You know, total hip replacements are so advanced these days that a lot of patients are discharged on the same day from the hospital, not the patients with CP. If you send a patient with CP out of the hospital on the same day as the operation, or even sometimes on the first or second or third day, they're going to go home, they're going to get stuck, they're not going to mobilize, their muscles will contract very, very vigorously, and they will come back to you even worse than what they were in terms of contractures and deformities. So HSS is and I'm sorry that I'm advertising so much, but it is true. I'm the old new doctor at HSS, and I really appreciate the opportunity that I had to work there. They never push my patients away until they're ready and comfortable and mobilizing safely.
Yeah.
Thank you, Dr. Selber, for coming back again.
Thank you, Kyla. Anytime. It's always a pleasure. You ask by far the most appropriate and best questions. I wish you all the best as always, and I wish that your listeners can enjoy and this little chat can be helpful to them. Thank you.